Yes, it is, and I think we've been calling out for a number of years this real concern around turnover in social care. What we've seen typically is somewhere between 30 and 40% of the workforce leave social care organisations in a given year, which is an incredibly high number for any sector, and most sectors would struggle to keep skills, keep experience in if they're seeing that level of turnover. But I think in the past, we've seen people who maybe leave the sector for a short period of time and then come back to it. And there are certain parts of the country where there's a long-standing tradition of people going into hospitality in the summer and then coming into care in the winter, and vice versa. So often there's a level of turnover, but it's the same group of people that are working within the sector. And I think in the past, other sectors like retail, hospitality and so forth have paid maybe the same or slightly more. And so there is a group of people that maybe cycle in those sectors. What we're seeing now is a very big difference between what care workers are being paid and what people are being paid in retail and hospitality. And I think that there's a danger that the adult social care sector overtrades on the notion of vocation, and it gets to the point where vocation and that positivity that you get from working in care doesn't pay the electricity bill, it doesn't pay the rent, and I think that's what we're starting to see. And the worry that I've got, I think, is if you've got 10-15% vacancy rates on an ongoing basis in care, then I think what you'll start to see is not being able to fill those vacancies, and overseas recruitment, which is what's being used in the NHS quite extensively at the moment, is going to work much less well in social care.